So let's talk about what people should look for in a addiction treatment facility, and we'll ask Susan to kind of chime in on that, since that's one of your areas of focus and concentration in the practice of law.
Thank you.
Yeah.
Yes. There were a couple of things, if it were my family member or loved one, that I would look for in a substance abuse treatment facility or addiction treatment facility, depending on where you are. But the first place I would go is I would look to the licensing agency. So in Florida, that's the Department of Children and Families. And I would make sure that that facility is, number one, licensed. And I would see if there were other complaints or had been complaints against the facility. Sometimes these complaints are really minor, having to do with paperwork. Sometimes they're very, very significant. The other thing is I would go to the Google machine and see what comes up in terms of reviews. Not all the reviews are accurate, but it'll give you some ideas of questions to ask the facility. One of the things that we find in Florida is that the pictures of the place are not where the place is. So you want to know, especially if you're not from the area, exactly where the treatment's going to happen, where your family member, loved one is going to sleep at night, where those places are in relation to one another. And if the housing is also something that is FAR certified. FAR is the Florida Association of Recovery Residences. There are certain standards that these homes should keep if they want to keep FAR certification. You could also look for complaints if there have been other complaints or any complaints against the facility. But if, barring that you don't find any of that stuff, then the most important thing is to question the people who are talking to you or your family member about what the services they offer. Specifically, what is the treatment plan? What is the goal of the treatment? How do they have it set up? How many hours a day are they actually in treatment? Who are they going to see on a daily or weekly basis? It's important that the people they interact with on the professional staff level are actually professional staff and not just other kids or other young people who have just been through their own program. You want them to see, professional counselors and psychiatrists. Is the psychiatrist on grounds? Does the psychiatrist visit to the facility frequently? They don't necessarily have to be in the place to do it, but they have to have regular contact. Be available to the staff and be available to your loved one as a patient. What else do you want to know? You want to know some basic things. Where's the fire alarms? What are the safety protocols they have for the housing? And how does their program adapt to each individual's needs? You will see in the Google machines, when you start looking at these places, they call themselves dual diagnosis. What does that really mean? You want answers from the facility. And I reiterate and say again, always ask them about the staff. Who is interacting with my loved one? And how often are they supervised, and what goes on a day-to-day basis? This is really the most important thing, because the well-informed patient will probably do better. And if any facility gives you kind of, sketchy answers, or you're not comfortable, you probably should move on. And that's really important, because the key to good treatment is that it is a joint effort, usually between the patient, the family, and the facility.